Hello everyone, and welcome to the second video of the phase 2 of the Bahmni-SNOMED integration project. In this video, we will see how we can export patients' data in bulk over FHIR and integrate with SNOMED's data analytics tool to do further research and analysis with that data. So, how this implementation has been done? So, let's say Bahmni as an EMR, basically we are actually registering and capturing patients' information, right? Let's say patients' demographics, then the condition, the medication that was prescribed, the service request. The service request in our case is nothing but procedures, right? So all these patient information can be, bulk exported in anonymized form where the personal identifiable information of the patients are not exported. And, the all these patient information are downloaded in the form of a file, right? Which we call it as, NDJSON files, which in turn can be, imported into the analytical tool. So this is how the, data flows through. So you download, you bulk export all the information about the patient, their condition, medication, procedures, then import the same into the analytical tool for further analysis. So basically, what benefits does this, the bulk file export and this analytical tool can bring to the table, right? So let's look into that. So while for SNOMED analytical tool, right, once it is integrated, it can enable the Bahmni adopters to, leverage the SNOMED ontology, right, for further analytics and research. So analytical tool in itself can help in, certain analytics and research, which can be really beneficial for the Bahmni adopters. In this way, users will be able to make meaning-based selections across the patient's population and can generate practical insights. So this is how the SNOMED analytical tool can be helpful. With respect to the bulk file export, right? So we have implemented the feature of both anonymized and non-anonymized patient export, right? So for anonymized clinical data, right, we can export the same as I mentioned and import it into the SNOMED analytical tool or any other research tool, right, which is FHIR enabled to support the research or further analytics. Now, let's say if a highly privileged user also wants to take the entire data export so that it can be exchanged with other EMRs which are FHIR enabled, that is also possible, right? So a full patient data export can also be provided and it can be exchanged between the EHRs which are FHIR compliant. However, by default, we do not allow the full patient data export. It is protected by privileges. As a normal user, the export will happen in an anonymized form where the personal information is not exported or shared. So these are the benefits of the bulk file export and the SNOMED analytical tool that we have implemented. Right now, coming to the demo, so we have taken up a use case over here, right? So the use case looks like this. So WHO basically, recommends during pregnancy iron supplements to prevent anemia and also improve the maternal outcomes, right? They also, recommend folic acid during the first trimester to prevent the neural tube development deficiencies, right? Now, in our case, let's say there is a clinic which is using Bahmni and they want to measure these benefits, right, of providing iron and folic acid supplements, as a strategy to see that, if these can be, this can be increased in terms of coverage to their patients and see and tell the results to the doctors that, hey, you know what, there's a major difference between, uh, patients which are taking these supplements and with the patients that are not taking the supplements. So that is our use case where the clinic using Bahmni wants to measure like what is the impact of these iron supplements. So just for our example, we can see the type of data that we have, right? So there are some patients, right? If we see here, they are diagnosed as with pregnancy and also with iron deficiencies, right? However, there are no treatments provided. I mean, there were no medications provided to some patient, whereas some patient, you know, when they were diagnosed with pregnancy, so they were administered folic acid as well as iron supplements, right? So this data is basically exported into from Bahmni to Snolytical tool. So the current population of data that we are talking about over the period of, let's say, 10 years. So let's say around 914 patients, right, who are diagnosed with pregnancy. So this data has been downloaded or FHIR exported and introduced in the Snolytical tool. So now let's move to the Snolytical tool where we will see the analysis. So here in the female, we'll choose the cohort as female and add the requirement as pregnancy, right? So we want to see, right, the impact of these supplements on, maternal outcomes, right? So let's say the outcomes that we are basically worried about, it's let's say premature delivery or iron deficiency, right? So let's add those outcomes here, right? The other one is let's say iron deficiency. Yes, yeah, iron deficiency and right. And what are the treatment options that we want to target against? So in our scenario, the population that we have, around 22 percent of the population were not given any treatment of any supplement, either iron or the folic acid, right? So we want to measure that against the ones which we have administered these supplements, right? So let's say we want to include that new no treatment option as well. And here let me name it prenatal supplements and add the medications, right? So let's say folic acid, right? So I choose a higher form where it can cover all the descendants as well. So I have taken folic acid containing product in oral dose form and let's say sucroferic, yeah, sucroferic hydroxide in product oral dose form. So this is nothing but a iron supplement itself. So I choose here, right? Now, basically, once we have provided all the data, what we can see here is that the rates of maternal complications, right, like iron deficiency, anemia, is drastically improved. Like currently, without any treatment, there was around 50 to 51% correlation of having iron deficiency anemia, whereas the patients that were provided or administered with these supplements had a very low correlation. So this was drastically improved, right? Once the supplements were provided to the patients. Secondly, for the premature delivery, we can also see there is a slight improvement in that as well, right? If compared to the patients who were not provided with anything, right? So basically, what this graph tells us, right, that this iron and folic acid treatment, these are basically low cost interventions, right? With no adverse effects, and it can provide clear improvements on pregnancy outcomes, right? So as a clinic which is using Bahmni, they can, share these results and ask their doctors and nurses to, work hard and increase the reach or the coverage, which is currently at 78%, to come as close to as 100%. so that if we are able to administer to most of the patients, then we will be able to reduce the unwanted outcomes like premature delivery or let's say any iron deficiency. So this way we will be able to use the data, this analytics, and share with the concerned doctors and nurses. Right. So yeah, this is how one clinic can export their data into Snowletical tool and do their analytics and share their results as and take any decisions as per their need. So this was about the second demo, which is our bulk FHIR export using the SNOMED analytical script.